So look at the most gorgeous, bloodless, oilless aspirate. So, you know, we go slow, but then we save time because we don't have to process this fat in any way with any commercially available systems. There is some systems that clean the fat or some of the blood and or most of the blood and oil, right? But I believe it's best just to obtain it bloodless to begin with, right? So that there is no oil and there is no fat or not significant amount of oil or fat. Because when we're doing a fat graft to the buttocks, which is what we're doing on this particular patient, if you put blood or oil in that area, in the buttocks, where the blood belongs inside the blood vessels, it does not belong outside. So wherever the blood or the oil is present where it doesn't supposed to be, it's gonna create a foreign body reaction. The body is going to treat it as if it was, say, a bullet fragment or a piece of glass and try to push it out.
Thank you.
Wow, so look at that most yellow, beautiful, bloodless, oilless aspirate. And we obtain these with gentle aspiration using microprocess liposuction. This is similar to a toothbrush. It's an electric toothbrush. And how many of you guys here have an electric toothbrush?
I do.
What about you?
Me too.
Leslie, you? What about Ramon?
Yes, I do.
Electric toothbrush, Brooke?
The necessity.
Yeah, and it's a necessity. And you, Emily?
Oh, yeah.
And me too, right? Does anybody have the old toothbrush here?
No.
No, right? So this is kind of the same thing, right? So we have the latest in equipment, right? But you have to use it appropriately. So if you go at it like an old toothbrush, it's not gonna work. Thank you. Wow, so what do you see there?
Beautiful yellow fat.
Wow, this is incredible here at the Cosmetic Surgical Center of El Cerrito. So this fat is completely oilless and bloodless. And so this is what's gonna go into her buttocks. Stay tuned so you can see what's gonna go into her buttocks. And this has many advantages to the patient. Of course, much less risk of anemia, blood transfusions, reoperation for bleeding, and foreign body reaction to the blood or to the oil in the buttocks in the form of oil cysts or blowout fractures or you know, encapsulated seromas and that sort of thing. Much less risk. Why? Because look at this. And this fat does not need to be processed in any way. Why? Because it's very pure. It's very, very beautiful fat graft. This is what's going to go into her buttocks. This is a very unique technique. So if you would like to have a procedure like this, please give us a call. This is really an incredible technique. It is many, many things that go into it. It's not just one thing. It's many, many things that we do. Going slow is one of them, and it's an important one. But there's many things that the tumescent anesthesia, how we do it, how we mix it, where we put it, the time that we wait before we start, the very important anesthesia, right, Ramon?
Yes.
Very important. So if the blood pressure is high, then there is going to be bleeding, right, Ramon?
Correct.
So you keep the blood pressure under control, right?
Correct.
Incredible. Thank you. Yeah, so look how comfortable I am. I'm not sweating it. My strokes are very slow. We don't do like 10 cases a day. No, just 1 or 2 at the most, right? So if you are going to do many cases in one day, no, you're not going to be able to get this aspirate. It will be literally impossible. There will be no time to put the tumescent anesthesia, no time to wait for it to react. But we have the privilege and honor to serve our community, and we take care of them. I care for my patients as it was caring for God Himself. I don't see them as just a means of monetary gain. I see them, and the most satisfaction that I actually get from my patients is to see their happy faces, you know, the transformations that we do here. This right here is an incredible transformation. You're gonna see it. I'm gonna show you the before photos the after photo after the tummy tuck, and you're gonna see a transformation now. We are going to create a high definition. We're gonna show those lines, the semilunar lines, which are the lines around the rectus abdominal muscles or the six pack, and we're gonna show also the supraumbilical linea alba. This is just incredible. But what I'm showing you here mostly is this beautiful output. This is just incredible. This is what's gonna go into her buttocks. So obviously she's gonna retain most of these fats. Why? Because it's pure fat. It's not fat mixed with blood. So probably the most important thing for you to observe here is the color. The color is incredible. Thank you. So right now I'm using my dominant hand. I'm ambidextrous for surgery, and most surgeons are ambidextrous for surgery. But even if you're a surgeon and you're not ambidextrous, right? Well, try using your non-dominant hand, and that will do a couple of things. One, it will force you to go slow. Therefore, maybe you can get this aspirate, right? It takes a lot of experience to do these, and we'll be happy to teach you how to do it. But also, it's good for the patient because it forces you to go slow, so the risk of internal organ damage or perforation of an intra-abdominal or intrathoracic organ is much less. Why? Because you are doing this in a very controlled, slow manner. It's like driving on the freeway. If you go at 260 miles an hour, you know what? That's dangerous. You can crash, And the same thing happens here. So we're the opposite of that. If we were going to do an analogy, I would say I drive 45 or 50 on the freeway. And most surgeons, I would think, drive around 75 or 80, So that's incredible. But it is great for the patient because it decreases the risk of internal organ injury and death. We never had anybody die. We never had an intra-abdominal or intrathoracic or any kind of organ injury, thanks to God, right? Except for the skin, right? The skin, you can have issues with the skin, right? The skin is the biggest organ, and we want to protect the skin as well. Alright, so I'm using my non-dominant hand here, and notice how my strokes are pretty much identical to when I go with my dominant hand. Slow strokes, protecting the patient, going at slow speed on the freeway, right? Sometimes you're going at the freeway, you see a guy that passes you at 200 miles an hour, right? What do you say? Well, that guy's crazy, right? And he's gonna kill himself and kill others, right? I think it's the same thing in surgery, The faster you go, the more risk there is, And the funny thing is that, when you get out of the freeway, you may see that guy stop on a traffic light, or God forbid, you may see that guy in an accident, right? Or he killed himself or killed other people, right? So we don't wanna do that. We never had anybody die. Our patients are extremely precious to us. I see the image of God in my patients, and I'm not sweating this procedure. I'm very comfortable, just relaxing here. The staff is comfortable. How does that make you feel, Ramon, when we do these surgeries in a bloodless manner? Is that less or more stressful to you?
A lot less stressful to me.
Yeah, tell me why.
Well, I'm the one over here managing the hemodynamics, and because you're saying you're driving a lot slower, I don't see as much shifts in the patient's blood pressure. Your heart rate doesn't change as much, and ultimately it helps you over there because we get that beautiful golden color. So
yes,
you help me and I help you.
Yeah, awesome. Yeah, very good. And so you don't have to give us much narcotics, and is that right?
That is correct. Less narcotics also helps out with less chance for nausea, less chance for respiratory depression, shorter stays. People get to get up and walk a lot faster.
And that's our anesthesia provider. He's one of the best. He graduated valedictorian, right? Yeah. The best in his class. And so, why is it that you have to give less narcotics? Look at that output. It's incredible.
One of the biggest reasons is because of that tumescent anesthesia.
And that's anesthesia that I give here, right? And I give plenty of it so the patient is not stimulated, so you're kind of comfortable there, right? The patients, that's why the patients walk out of here like nothing happened. Like they just, went to the beach without any significant nausea, vomiting, pain, walking straight up, literally walking home. And when they walk, they prevent the most lethal complication, which is that of a blood clot. That's the one thing that can kill you. Thanks to God, we never had anybody die. Want to keep it that way. But it's just a combination of things. The patients are full of energy. Why? Because they don't lose any blood. Look at that. You see any blood loss here? So they don't have anemia. And as a result, they're going to recuperate a lot faster. And there's a lot of other things that are beneficial when there is no blood loss. Less risk of, in cases of liposuction, those fibrotic, painful bands, right? That's also something that usually emanates out of a central hematoma, giving you the octopus effect. And thanks to God, we never had one of those cases, but that can be difficult for the patient. It's not going to kill the patient or anything like that, but it's just painful fibrotic band with a central hematoma. And it's similar to an octopus because the body of the octopus would be the collection of blood in the middle, the central hematoma, and then the tracks of the liposuction are the tentacles. Oh, so high definition liposculpture on this patient, incredible. Look how beautiful she looks. The semilunar lines on either side of the rectus abdominal wall muscle and the linea alba. Beautiful, thank you. We're gonna make a waist out of this. See how it's like that? We're gonna make it the opposite of that. And she's on her side, the buttocks are over here. But notice the completely bloodless, oilless fat graft. And we're going very, very slowly here at the Cosmetic Surgery here with Dr. Gabriel Patino. Give us a call if you would like to have a procedure like this. This is unbelievable. Operators are standing by. The number is 510-525-7999, 510-525-7999. We'll show you how she's going to look later on. We're going to cater in nicely, and we'll show you the pinch test later on, but this is just absolutely incredible. Thank you. Wow, look at that. We don't stop. TikTok, you never stop. Dr. Patino will never stop. Look at this, huh? Yeah.
We'll never stop with that yellow fat.
Beautiful, beautiful yellow fat. So, when you see the fat graft to the buttocks, look and pay attention to what goes into the buttocks. If what you see is red or pink or whatever, that means there is blood in it. But if it's yellow like this, then your fat graft is going to stay, because usually you lose about 30 to 50% of the fat. It just, gets reabsorbed. The blood that doesn't belong in there gets reabsorbed. And with that, you get to maintain a lot of the fat graft because it's cured. And it's very simple, right? And also, the great majority of the fat graft dies up to, like I said, 30 to 50%. And that has to do with how careful the surgeon is at obtaining this fat. If you're doing very aggressive cannulas at full speed, there is going to be trauma, there is going to be bleeding, there is going to be oil. But in addition to that, you're going to destroy the fat cells. So, also, some technologies can destroy the fat cells. So if you use energy devices, some of them can destroy the fat cells. So, what good does it do to transfer fat to dead cells, right? It doesn't. So, a lot of things go into it, but a lot of it is just gentle aspiration. The system that we use also is a closed system, so the fat is not exposed to the air, so much less risk of contamination. There's a lot of things, Even the bloodless technique provides less risk of infection. Okay, so look how much better she is. Her waist is more like that instead of going like that. And the buttocks over here, she's on her side. So I'm going to show you the pinch test, see? We're to 0.5 centimeters, pretty much everywhere you go. This is the beautiful waist. You see that? Very, very beautiful. Just absolutely incredible. See? Here at the Cosmetic Surgical Center of she just looks great, Thank you. Alrighty, what were you saying?
Where can they get A cinched waist, doctor.
Oh man, right here, the Cosmetic Surgical Center of Costa Rica. Look at that with Dr.
Wow.
Patino. Look at that. This is unbelievable. This is the pinch test, and this is part of the surgery. So we do it. Look at that. Everywhere we go, and this is the waist. Thank you. So notice how this is the other side. Look at that, huh? This is the big bulge, right? We're gonna leave her like on the other side. Here, you cannot even like. This is the pinch, right? Brooke, you were saying that that people can think that that you're just trying to make it bigger than it is. Try and make it smaller, like the other side. Use both hands.
Yeah.
Can you?
That's it.
No?
No.
Convinced?
Yeah.
You can't, right? So
Yeah,
that's what it is. So you can't really pinch because there is a lot of fat here. You can't really. This is it. This is how big it is. It's
Are those
huge.
the love handles, doctor?
This is love handle.
Oh,
You got that right. Look at
wow.
that. Compared to the other side. So
Okay.
we have the cannula. So we're gonna show you how we do this and how it's gonna be very, very beautiful. You know? Very, very beautiful. So we're gonna start sucking this fat out. We call it liposuction. I just say sucking for people to, be more in the non-medical
Yeah.
terminology, right? But it is what it is. It's basically just beautiful, beautiful yellow fat. I'm gonna show it to you in a little bit. Maybe you can see this part here, right?
Yeah, show it to me, doctor.
Yeah, I'll show it to you in a little
Okay.
bit. A little bit, but this is what's coming out. Absolutely yellow, beautiful fat, like you've seen before, right? Nothing different. See, I'm gonna show it to you. See, so maybe Brooke can show it to you. See
Oh, there
that?
it is.
See?
Ah.
Very yellow, beautiful fat, right? That's where it is here. Incredible. Just unbelievable. And look at that. See, Brooke and I'm showing it to you. How gorgeous that is, right? Follow it all the way to where I'm at. See? Like that. See? Beautiful. See? Very nice, right? So throughout the procedure, this is the oilless. Wow, do you see the waist now? Compared to
Yes.
what she has? She had a bulge here. Look at the nice waist. And this is the pinch test, guys. 0.5 centimeters. You see that? Absolutely. We cannot fake this, you guys. I cannot go, oh, it's that big. No, I can't, right? It is what it is, right? Before it was huge. It was like this big. Now look at this. See? That's the difference in the pinch test before and after surgery. Beautiful waist. Patient's on her side. Buttocks are over here. She just looks incredible. Everywhere you go, beautiful pinch test. We can go this way too. Look, we can do it this way too. See? See, I don't know what's best for you to see, but that's what we got here. See? Everywhere. Even here in the belly area, we are to 0.5 centimeters everywhere you go. Thank you. Okay, so we're doing ultrasound guided gluteal fat transfer. I'm looking at the patient, I'm looking at the ultrasound, and I'm looking at that beautiful oilless, bloodless fat graft. It's exactly what I predicted. Yellow, beautiful fat. Is the way we took it out. This fat has not been processed in any way whatsoever. And we're putting it under ultrasound guidance into the deep subcutaneous space according to the World Association of Gluteal Surgeons guidelines to keep this procedure safe. Thank you so very much. This is alrighty. So I want you to focus on the top line. That's the skin. Then there is another line that is broken up. It's not a complete line. That's the superficial gluteal fascia, and then right under it is a solid, very bright line, the brightest line you see, which I'm going to wiggle. You see it? That's the cannula, and I'm going to redraw it so you can see the tip of that cannula. As I'm withdrawing it, you can probably see how that tip is coming into view. You see it right there? That's the tip of the cannula, right? And below it, oh man, and this patient has a very, very narrow deep subcutaneous space. So right below it, right below this cannula right here, is the deep gluteal fascia, and right below that is the striated muscle, the dangerous area where you don't want to go, because you can perforate the superior or inferior gluteal vessels, and they will suck up the fat graft into the main circulation, into the right atrium, and into the pulmonary artery, and into the lungs. The patient will die immediately or within 24 hours. They're almost 100% fatal. Thanks to God, we never have this problem, but this is why we're promoting ultrasound guided gluteal fat transfer, because this procedure is normally done blindly. So the surgeon, if he misses in the cannula, instead of putting it here, he puts it down there, we got a big problem. So notice the tip of that cannula right there, and you're gonna see a gray cloud, and you're gonna see how the deep gluteal fascia along with the muscle gets pushed down on the count of 1, 2, 3. Look at that tip of the cannula, and look at that cloud that's gonna start coming in right there, okay? So let's do it again. 1, 2, 3, go. You see that? Wow. Wow, so look how the fat graft is pushed, it's making the space bigger, right? And I inject this at control, and it's literally, you can even see the fat coming out of the tip of that cannula as a gray cloud, and how now the space is a lot bigger, right? And actually you can see the striated muscle below, it's just unbelievable. Beautiful, beautiful anatomy, thank you. Wiggle the cannula, and you see after this, above is the superficial gluteal fascia, below is the deep gluteal fascia, and watch the gray cloud coming out of the cannula again, pushing the deep gluteal fascia down, making this deep subcutaneous space larger and bigger. And you see that gray cloud